today is all about responsible leadership. We have two great people that are going to speak and reflect on today's episode. One is Toyin Deinde. Toyin is a seasoned business executive, advisor, and leadership strategist with nearly 25 years of experience across the biopharmaceutical, healthcare, and insurance sectors. He is the chief executive of June Advisory & Co., where he advises organizations across Africa and the UAE on strategy, growth, and transformation. Our reflector today is Abiola Oshunniyi. Abiola is a global development expert and system strengthening consultant with nearly 2 decades of experience across health, sustainability, and international development. He currently serves as the head of the project implementation unit at the Nigeria Center for Disease Control and Prevention, overseeing major national and donor-funded health programs. Abiola has led multi-million-dollar initiatives supported by organizations such as the World Bank, the UK government, and the Bill and Melinda Gates Foundation. Welcome so much, Abiola and Toyin. Toyin, may I ask you to take the mic and present your story, which is titled today, Reimagine the Employee Value Proposition. How competitive is your health and benefits strategy? Toyin, please go ahead.
Okay, thank you very much, Toyin. It's a pleasure to be here and to share some of these thoughts. Thank you to Abiola who's accepted to reflect on this topic. I think as leaders, we talk so much about influence. We talk about the fact that we're envisioning something, particularly when it comes to maybe starting up enterprises or providing leadership for enterprises, both internal and external stakeholders. And in that journey of envisioning as well as implementing the strategy, whether we're driving for growth, expansion, or whatever it is, or we're trying to do some advocacy or some activism, depending on the kind of enterprise that we're involved in. It is important also that we ask ourselves, beyond the product, beyond the place, beyond the platforms, beyond the partnerships, that we also, review what it is that we have for our internal stakeholders who are employees. And most of the time, organizations do so very well with, employer branding, but then they ignore the authenticity as well as the effectiveness of the employee value proposition. So, and in that market, it is important that we also ask ourselves, while people want jobs, while people, we are paying to get their skills, their talents, their experiences, their commitments. We also ask, what are we offering as business leaders? What are we offering as entrepreneurs? And so beyond the salary, so today, we'll just be asking ourselves, really, in our employee value proposition strategy, which is part of the employee talent strategy, how competitive is our health and benefits strategy. Employee health and benefits, basically, we talk about non-salary indirect compensation that we offer, and that would include the kind of health coverage that our employees get. That will include things like wellness programs, the financial support in terms of life insurance, retirement benefits, and all that. The work-life integration, which basically is another important bucket in its own, as well as the support system, which is popularly called as employee assistance programs that we offer in ensuring that employees can deliver value. Employees are happy delivering that value, and then they can be more productive. Um, we know that so many employers, so many organizations will look at health and benefits as a cost center, and it's all in reality it is expensive. But I think we now need to flip it to look at it as an investment that will return the kind of ROI that we desire. So, um, like we know, medical costs constitutes is about 4 to 5, 6% above headline inflation, and particularly in spheres like ours in Nigeria, for instance, employers pay for care. 70% of employers pay for care out of their pockets. But also, we know that studies have shown that employers who feel valued, who feel cared for, um, are 30% more likely to stay with an organization. So, and that is very important because then when they are focused, then when they feel happy, productivity increases by another 20%. Um, and most of the time too, HR people and business leaders believe that, employee health is improving, and that is the uh, metric that is being measured. But also, it is important to know that 64% of employees also are struggling with other things, while access to care is there, but then there is the issue of mental health and the fact that other benefits are not being used because either people are not aware that they exist, or they do not know how to access it, or they do not trust the system enough that they're going to be getting value. And while globally, for instance, in the US, 97% of employers provide some form of health coverage for their employees. In Nigeria, I think the last stat is about 21 million that have some form of health coverage. If we extrapolate that into the workforce, then we'll be talking about less than 10% of employees that have some form of health coverage. So looking at some of these things too, I think it is important to relook how we see employee value propositions, how we look at the strategic importance that health and benefits play in that overall strategy. And this is particularly important because in the last couple of years, we've been having a new influx of very young people into the workforce. Popular, we call them Gen Z. And this is important because their health needs, their needs generally, not just health, is quite different from what we see as maybe people that are much older that have been in the work environment for quite a bit. And the fact also is that we're having those who entered the work environment in the 90s, in the 2000s, or much earlier, are becoming older. And as people become older, you discover that the healthcare needs, the healthcare profiles, differ. Then you see non-communicable disease being on the increase. It's almost like having a car. Just having an oil change for a 40, 50-year-old car would not suffice. So those dynamics are things that should be looked at. The other reality is, it's also important that we know that now, some weeks ago, I was having a discussion with a middle level manager who is actually quite senior, and the reality of remote or hybrid work is also a thing. Some people, it doesn't matter how much you're going to be paying, if you're going to be offering hybrid or some form of remote work as in the value proposition, is something they would not consider. And in the last couple of years, I would say pre-COVID, COVID, and post-COVID, people are beginning to look at total well-being experience. So it's not just about absence of sickness. People are beginning to look at what are you offering for preventative health, and that will start. People can get an indication of that when we do pre-employment tests, when we do, and all that. People are also asking, what are you providing for my psychological safety? This is becoming, a jargon that is become, pushed in the face of employers, for leaders, and for people who may be able to influence some of these decisions. So these are very interesting times, and then we must consider that accordingly. It's also important that while as leaders who run businesses, we want to provide the best for employees, but then we also need to, put an eye on costs, because we need to deliver value to our stakeholders, particularly shareholders. So inflation is a thing that employers are looking at. Inflation is another thing also that employees also are looking at, because recent reports, for instance, show that people, rental cost is beginning to take up as much as 70% of the earnings of today's employees. So while the salary might be competitive, they also want to know, do I have to, when there is a medical need, do I have to pay out of pocket? And if that is a yes, or they are really not they are not very sure, then they might be really looking at other options. And while they may still be there, they might have, maybe, quite quitting. They are still on your payroll, but then they're out of the door at the earliest opportunity. And then in the marketplace, particularly in the last couple of years, with the emigration, particularly from developing societies, from emerging markets into markets that are more structured, that have social protection schemes and all that, there is an increasing demand for talent. People who can hold their onions. So what are you offering? If all that you're offering is similar or is the same, then people do not see why they should be joining you. People do not see why they should be staying on, staying on to continue to contribute their skills, their experiences, or even much more importantly, give you their maybe 105% support. So it is clear that traditional EVPs are no longer in vogue. There is a need to reimagine that. There's a need to go beyond the regular if we're going to be responsible leaders. So health and benefits is actually an offering that overlaps the three top drivers for employee attraction and retention. So while we're talking about the remuneration, we are talking about giving people a sense of belonging, making people feel valued, providing flexibility, making employees feel that they are part of a larger purpose, and then they want to stay. And so while we as employers or as leaders are looking at the kind of people that will bring on board to help us deliver on the vision that we have for our enterprises, employees are now also evaluating us as leaders to ask, is this the kind of organization I want to join, and all that. So benefits directly influence productivity, improves engagement, and reduces burnout. So our healthcare cost needs to be smarter, not necessarily because we need to push in more dollars or naira, euros, but it's just a call for us to be smarter with our healthcare spend, and then ensure that we have an hedge in the marketplace through personalization and flexibility. So what would good look like? So when we're talking about having a health and benefit strategy that is competitive, it is important that we are transparent. What are we offering? People should know. Educative sessions where people can ask questions, having open house where maybe during some particular programs, maybe quarterly, people can walk in, or even if it's going to be virtually, ask questions about their healthcare needs. And then, that should cover not just when people are sick, but preventative care, mental care, psychological support, and it should be easy to access. and then it should be tailored to meet the the diverse needs of the workforce that we have, the young, the old, the married, the unmarried, and people with children, people who may not have children. And then there should be some form of incentives, and we can think about gamifying some of those initiatives around preventative care, gamifying things around digital tools. We know that employees are human beings, and so they are social, they want to interact. And then when we put them in groups where there is some form of challenge that they can track, maybe through a web portal or an online app, it improves engagement. And in designing some of these benefits, it should be data driven. We should continuously, evaluate, is it achieving what I set it out to do? Or if not, what can I do differently? So these are also important things that should be done. So the days of just cutting and pasting, I mean, manufacturing or an educational institution, what does this other school provide? Then I try to replicate it without looking at the nuances of your own workforce that you have currently or the workforce that you aspire to have. So in trying to draw down so that we can actually have some time to engage, I have 3 questions for us as leaders this morning. And the first question is your health and benefit structure or strategy, does it reflect the workforce that you have? And 2, does it reflect the workforce that you wish you had? Because at times, enterprises are still, in fact, are still young, and then we aspire as part of our, bigger picture, like we say in leadership parlance. So your benefit strategy, does it reflect the workforce that you have now? And does it reflect the workforce that you wish you had? And at times we spend money. It's almost like companies put in budgets. We buy maybe company cars. We buy. We want to give food items. Maybe provide free lunch for employees. But actually, we asked ourselves that question: what we spend money on in terms of benefits, now looking at maybe health and benefits as a class, is that actually what our employees value? That is also an important question for us to answer. And thirdly, whether we like it or not, there are so many people providing either the same services that we provide. In some industries, it's almost like, it's generic. So how do we stand out in that crowded talent market? Are we, looking at our employee value proposition? Are we looking at our health and benefit strategy and saying why would people want to come to BSN? Why would people want to come to, in these vast and crowded markets? So as I close, and I hope we'll be able to at least ask ourselves, these questions and provide answers and continue the discourse even after today's session, is when we are talking about reimagining employee value proposition, it's not necessarily about spending more. It's about ensuring that what we offer is what our employees want, and that what we offer is what matters the most to our employees. I think I would like to stop at this point. And once again, say thank you for everyone that has been able to join. Thank you. I'll go back to you, Toyin.
Thank you, Toyin. Thank you so much. Interesting read. Interesting to learn that some issues are the same all over the world, not only happening in the country. Let's switch over to Abiola, who's going to reflect upon your presentation. And after that, there's the possibilities for the audience to ask their questions. So please give the word now to Abiola.
Yeah, good morning, colleagues, and thank you, Toyin, for a wonderful and compelling framing. And Tony, thank you for moderating the session. It's been quite interesting. Just as a reflection, the data that Toyin shared, the rising cost of care, inflation, and quite interestingly, the 1.5x retention differential when employees feel cared for. and the fact that only 3 in 10 employees, believing leadership prioritizes actually their mental health and not just HR indicators. They move from HR indicators now to really us saying we're operationalizing key components of ESG for responsible organization, ESG being environmental, social, and governance, which are key sustainability frameworks for organizations. From where I sit, because of my work at the intersection of public health systems, development financing, development organizations, and institutional reforms, they signal some some fundamental parts. First, it's, really a structural mispricing of human capital. And I've seen this a lot in different contexts, within Nigeria and Africa, where if you look at the effective coverage, which remains around, like what Toyin said, between 9 and 13%, what we call benefit gaps today are actually, system failures with direct implication for resilience, productivity, and actually national health security or regional security. And from my work with all of these organizations, particularly at the NCDC right now, and a not-for-profit that I co-founded, the Badli Institute, I've learned a particular recurring theme. You cannot actually build resilient health, financial, and economic systems if the people who power them are themselves unprotected, and you see this every time. And, just like Tony alluded to, you definitely will see people that, it's a fight or flight mode, where if you find an organization that offers them, or an environment that offers them something that seems to give them a sense of security, they are able to actually just move. Beyond healthcare benefits, and I just wanted to highlight this, there are some key aspects of other social determinants of health. And all of these things directly impact the productivity outcome of an individual, and then, of course, the total organization. And so you kind of mentioned it, and I just wanted to share this. The WHO, even as far back as 1948, defined health as a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So essentially, you then need to really look at it as an organization, as a person, either working in HR or at top leadership, are the benefits provided by the organizations to employees just focusing on a physical, or, is it an absence of mental or social well-being? Or is it a sort of hybrid that doesn't really provide holistic health, really, for the employee? So 4 key areas of reflections I just brought out of this. And, like I said, it was just interesting listening to what Tony said earlier. And, it's key. In high income settings, employees always benefits, always enhance well-being. Data has already shown that. Africa and other contexts, these benefits actually substitute where there are absent systems, and this distinction is critical. So if I'm building an organization in the global south, or I'm building an organization in Africa or Nigeria, I know that certain systems are not working, and I know that the benefits I give to employees are actually substituting what should have been like social capital that they would have been able to benefit from. So I am actually creating an environment, a holistic environment for them to thrive. So when employees and frontline responders face financial vulnerability from basic healthcare needs, the issue is no longer employee satisfaction. It is an operational risk within the employee and organizational security architecture. So what will make an organization survive, it is beyond just designing, just what you call a regular employee benefit. You are thinking about it from an operational risk point of view. So if you have a high value asset that leaves, then it becomes a problem, because they are leaving not because they want to leave, but they need to leave. It's a survival thing. What we're discussing, therefore, is that, EVP is not just needing to be traditional, but EVP needs to be distributed infrastructure, from continuity to preparedness to response, to helping an organization manage, the evolving landscape in the current context. The other, reflection for me is really about, the convergence of what we call digital today. And I think Tony touched on it a bit. Today, you find out that there are so many solutions that exist And if we cannot build the traditional infrastructure that we need as a continent or, as the global south, we can then leverage technology to be able to achieve better frameworks. So for instance, how can telemedicine be embedded in institutional ecosystems? Predictive analytics for, like Toyin said, for workforce burnout and, workforce risk. How do we use digital to look at preventive behaviors, providing preventive care tips to them, and, also helping workforce to become better performing. We've done this with, fintechs in a way where we've leveraged technology, like M-Pesa and NIBS in Nigeria. But how do we then bring it further beyond just enabling what we call the everyday aspect of life to how do we, kind of embrace technology to improve efficiency, to helping employees become more productive. And I like what you said regarding the aspect of the mix of hybrid work, and the mix of benefits. I think my second to last reflection is, and it will just be a question, how do we design institutions that, that are both able to attract high performing and are people centered? Because most times when you see high performing organizations, they are fairly not people centered. They sort of are, very built around deliver at whatever cost, not at really the cost of, well-being of the employee. So in our realities, are you looking at, employees are a function of an extended family reality? They connect to a informal and, semi-formal workforce structure. How are you looking at the communities that come in around them? There is a concept of preventive, non-reactive healthcare models that you need to give to them, and essentially seeing health as, or healthcare benefit as, a shared public good, because at the end of the day, healthy workforces drive productive economies. Productive economies attract sustainable capital. And my last reflection is really around talent retention. Fundamentally, across global health and development systems, one pattern is consistent. We underinvest in people who deliver the outcomes, and that's what I started with. And the retention of critical talent is not a high priority HR metrics. It is more like just a system indicator that we look at on the side. But this is something that is a systems performance indicator that tells us how are we really doing well. When talent exits due to inadequate protection, we're losing not just staff, but we're losing institutional memory, response capability, and return on long-term investments by, governments, organizations, and the private sector institution that has employed them. In that sense, EVP becomes directly linked to program sustainability and, a lot of organizational long-term goals. Let me just leave you with 3 questions. I'll do similar to what Toyi did, just 3 questions. Are we really designing EVP as administrative frameworks or as a strategic infrastructure for organizational resilience? Are we measuring benefits for cost efficiency or by their impact on retention of critical capabilities within our systems? And if workforce is the front line of organizational sustainability, security, and resilience, are we investing in their well-being with the same intentionality we apply to other business operations? Because ultimately, in Africa and in the global south, the competitive EVP is not about benchmarking against London or New York. It is about refining value in a way that is contextually relevant, systematically intelligent, and future-oriented, the future of work that we know. Like you said, he talked about the Gen Zs and how they relate right now. It is a governance, development, and systems transformation agenda. People are not a cost center. Humans are the foundational infrastructure for health security, economic productivity, national, regional, and global resilience. And if we get it right, we are also actually building better organizations and better globally competitive institutions as well. So they are resilient, we have stronger economies, and we have a more secure global system. Thank you very much. And these are just my reflections.
Toyin, you are muted, Toyin.
Sorry about that. I was talking but muted indeed. Thank you, Toyin. for pointing it out. So people, we are now open for questions and remarks. You can do so by using the chat button in the bottom of your screen or using the Q&A button. Some questions and a remark have already come in. And the first remark is from Karen Gerald. And it's telling us the deeper issue is that most organizations design benefits around assumptions rather than evidence. They assume what employees value without even asking them. The result is investing in benefits that look good on paper but generate very little genuine loyalty. Can you give a response
Okay.
to this? So is this happening, and what's the effect?
Yeah. So thank you, Toyin, and thank you, Karen, for that question. So for about since 2015 thereabouts, I was in an organization and I ran a health insurance business and were involved in designing employee health and benefits strategies and all that. So we know what the problems are, but I think the way out is actually to conduct what we'll call a benefits competitiveness audit, conduct a benefits audit. And how do you do that? You need, so I think the days, like Abiola said, of treating it as just an administrative task, those days are gone. Forward-looking organizations, best-in-class organizations now would conduct, form what you may call a committee. And at times you put it, brother, you send out questionnaires, have a survey. What really would they like? Why you have a benchmark? What are those things that matter to them? For instance, if I am a business leader and because I am hypertensive, I am more particular about cardiovascular health. And then maybe I'm just in the 1% of 1% within that age bracket. Then I have young people who are more interested in preventative care, wellness benefits. They want gyms, access to gyms. They want spa. They want access to procure healthy foods, maybe at a discount. Some form of that incorporated into all of that. People want to attend seminars, want to know what is going on. So we must listen to employees to be able to shape the benefits and then do an audit, even what you are spending money on. And some of the other things, maybe in trying to round this off, is leaders. We just look at, we have 3,000 employees. How many actually utilize? And that's a wrong approach. It's not just about the number, because the essence of some of those things, for instance, you have health insurance or have some form of pool to protect the vulnerable, is that the healthy should subsidize the sick. So it's not just about the number of people who access. It's to say the people who access, what are they accessing for, and what value are we getting in return? So it's to look at the value, not just about the count, which is just a stats that is not going to help anybody. Thank you.
Thank you so much, Toyin. And that also answers Joop's Van Nierop's question about some, let's say, examples of what companies can offer to their employees to do to work on their physical and mental health. So that's kind of locked into your.
Yeah. So I think, like I mentioned earlier, is you must incentivize it. For instance, I know organizations. You must look for a way. I know of a bank who would attach Christmas bonuses to those who have done their annual medical checks. So if you have not done your annual medical checks, and when it's time to pay bonuses, Christmas bonuses, because it's at the discretion of management. By November, they are not asking you to show them your results, because that is supposed to be private. But then if your name has not featured on the, that you have accessed your annual medical checks that year, you may not get it, or it may be delayed. Other incentive that we may attach is, maybe have some form of gamification, like I said, give, bottles, have a dashboard, and people don't like to lose, put them in teams, and then say, okay, team A has 70 points, and maybe every Monday you put that dashboard as people sign into their systems. So, that encourages, and then you can have some form of discounts for people who go to the gyms, for people who maybe who participate in some form of fitness challenge. Then maybe you could sign up with, depending on who your health and benefits partner is, or maybe your wellness advisor partner with, then people can go to a shop and then they get discounts on nutritional foods. Maybe when they're buying fruits and vegetables, for instance, or people get some form of incentive for smoothies or whatever. So you look for something that would appeal, but then it also boils down to knowing your employees that you have currently and the kind of employees that you would like to attract. Thank you.
Perfect. So we're running out of time. I just have time for a small question that I just picked out randomly. And this is Perpetua asking, how can organization measure the business impact of their employee benefits beyond just costs?
Yeah, so I would say that, and maybe, we can also look at it. So one of the things also to look at is, for instance, when people do annual medicals, you can patch ailments on time before they become high ticket items. For instance, if you X-ray the work environment, so look at the ergonomics, what is the seating arrangement, then if you can improve on that, then you are sure that you are not going to be spending money on people going to see the doctors maybe for orthopedic or pain or whatever it is. So that is also how to measure. You measure absenteeism, you measure the reduction in times that people have to take excuses because either they have to take their children to the hospital, and then for another financial services provider that I worked with, what we found out is while the employees are the lower cadre, you may not necessarily be able to move them from places where they are susceptible to get bitten by mosquitoes and all that. So when we found out, looking at the predictive analytics, what they did was just also to start investing in chemical treated mosquito nets that were distributed, and that brought down a reduction in incidence of malaria over a 2-year period. So that helps panel where you will be directing your investment as a leader or as an employer into, and then you can see some of those things. And then productivity generally it's clear if we track it properly, and then it's not just enough to track what are you doing. When you notice deviations, then you need to course correct and all that. So I hope I've answered Perpetua's question.
Great answer for me today. Well, the compliments are storming in, so I will read out the last one: a truly impactful and relevant presentation, followed by awesome reflection. And that kind of is the capture of what's being said over the chat room today. I would like to thank you both, Abiola and Toyin, for a very interesting presentation and a very meaningful reflection upon that. And of course, for answering the questions from the audience. There are more questions coming in, but we don't have time for that. So I will redirect those questions to you after the show. And of course, there's the questions that both of you asked yourself. So perhaps you want to elaborate on that after the show. I will ask Paul to contact you and see how we're going to do that. For now, it's the end of this episode. Next week, we're going to talk about strategy to execution, leadership decisions that drive sustainable performance. And on the show that time is Velmon Toby Late and Reflector Olusegun Akiyemi Ayu. Thank you for now. Thank you all. Hope you had a fruitful session. Hope you have a great day after this one, and hope to see you back next time. Thank you.